My name is Dr David Boshell. I'm a vascular and interventional radiologist and I work at Sydney Adventist Hospital. The addition of SIRT therapy to existing chemotherapy or to surgery, or perhaps after surgery, is now allowing people to have an extra option that they wouldn't have otherwise. We are gathering the evidence from large trials that can show that this is an effective therapy, and it's also a very well tolerated therapy. We deliver the treatment in a one-off process. It doesn't require you to visit hospital over multiple weeks. For example, you may need to have radiation delivered in multiple fractions if it's delivered externally. And if you're having chemotherapy, you may need to attend the hospital for several weeks. We can deliver it in one go. It's a procedure that can be repeated, but once the treatment is in, you don't have to keep coming back to hospital. So what we would do is we would assess these patients to see if they are eligible for treatment with an angiogram procedure. It would be very similar to the angiogram procedure we perform for the actual treatment, but we do need to do an angiogram to see if they're eligible first. That is usually a one-day visit to the hospital. It doesn't mean that you need to stay overnight. You can have that procedure in about 1 hour. You have a few accessory procedures. You might have some CT scans done, or you might have some done previously, and you have some nuclear medicine tests also performed. Once we know that we can take you to treatment, then we order the treatment and we can schedule a day where you would come into hospital and you can have the treatment inserted in a procedure that probably takes about 60 minutes. The SIRT therapy is not a therapy that is designed to block off the arteries or the blood supply to the liver. It's a therapy where we actually use the vascular system to deliver treatment. That means that because there's no blocking of blood vessels involved, it's usually very well treated. It means that if you do get pain or you feel sick, usually the symptoms are quite minimal, and it's something that we can actually control just by giving you a little bit of special medicine at the time and perhaps a little bit of light sedation. And most people would be able to go home perhaps the day following their procedure, the morning after their procedure, and in some situations we could probably send people home on the same day if they were well enough.